under her butt.
Hi, my name is Shelby Nelson, and I'm going to be demonstrating how to put in a catheter. This is a male, just so you know. First of all, I would come into the room, I would identify my patient, I would check their chart to see the last time they urinated, their level of awareness, their physical limitations, their gender and age, any allergies, and their perineal status. Before beginning, I would go introduce myself, of course, identify them by their wristband, and make sure that they can tell me their name and birthday. After doing this, I would explain what's going to happen, what I'm going to do, so they aren't just super surprised. And then I could ask another person to help me, but just for this reason, we're not going to. So first, I would go and I would do hand hygiene. I would then do apply gloves and do peri-care to make sure that they're clean before I did anything with a sterile procedure. I would provide privacy before any of this, which we already have done. Make sure that the bed is raised, everything's locked, in good condition, all ready to go, which it is. And so with that, I will just start. I'm going to grab my supplies, which I have here. I'm going to make my little garbage bag at the end of the bed. Okay. So I'm going to get all of my stuff ready to go. So I'm going to start with opening this, trying to stay sterile. I'm going to start by putting on my gloves so that way I can touch all of the sterile things by only touching the outside border. These are a little bit sticky from sweat. Being careful not to touch the outside part. Again, now only touching the outside so that I don't contaminate my other glove. Get myself a little bit more situated here.
Did I forget anything?
No.
Okay, so now that we have this,
I inserted 5 milliliters of water, but I didn't blow it up. What the heck?
remove this out of the way.
What's your email address?
I'm going to start by draping our patient
Okay, there's the water.
with our waterproof barrier with the shiny side down. I'm going to wrap this around my hands so that I don't touch them at all. Just like that. So I didn't touch at all.
Oh, wait, yeah.
I'm not going to use this other drape just because I just don't want to. Okay. So then what I'm going to do is I'm going to start by setting up my little tray here. I've got my sticks and I'm going to open in my tray here. I also have some lube here in my tray. I'm going to use this.
You don't use that lube.
I know. I have some in here from a different, I didn't actually use this, I used a different water soluble lubricant. So with that, I'm going to take this here and I'm going to move my entire tray to the bed so I can set this up. So then I would take off this rubber or the plastic sheath, being careful not to let this touch anything. Putting this into the lube to make sure that it gets lubricated. This is my garbage area. With that, I am also going to attach my water to my cap down here. Okay, so everything is all set to go, and I'm ready to insert. Okay, now before I start anything, I'm going to clean the area, knowing that once I touch with my right hand, that this hand will be contaminated. So I'll start here, holding the tip of the penis, and I'm going to clean around with a swab. Do it again. Here. And one more time. Here. Okay. So, once that is cleaned, I can then go ahead, tell them to bear down, and I'm going to insert the tip of the catheter without touching himself until I see urine, and then once I see urine, I'll keep going another 2.5 to 3 inches. Okay, so once I have this inside, I am then going to inflate the balloon with 5 ml of water or sterile solution. Then, after I do that, I'm going to pull just until I feel tension. So I would feel tension there, which means that it is inserted. And then after I do that, I can go ahead and hang the bed on the side of the bed to start collecting urine. And that would be, I would clean up, wash my hands, make sure that he's comfortable, everything's feeling okay. Wash my hands, clean up, and that is how you do and insert a catheter.